Welcome to this short lecture on both the development of the tongue and the development of the thyroid. This is really a continuation of the lecture that we did on the pharyngeal arches. So if you haven't seen that lecture, I encourage you to go back and view that before you continue with this one. So to start with, we've got the embryo here sitting at approximately the 4th week. You can tell it's the 4th week by looking at it because you start to see the limb buds starting to pop out, and because you've got 4 limb buds, it's easy to remember that 4 buds, 4 weeks. So this is about the 4th week of post-gestation, and so I'll start by producing the development of the tongue. So if you were to look at the embryo, you've got the head end here, there's the eyes, there's the 5 pharyngeal arches, the pericardial bulge, the upper limb, the lower limb, and the connecting stalk. So if I was to do a cut through like this, so a coronary section through the embryo, you would have this image here like so. And so we've cut through the pharyngeal arches, and what I've done here is I've put them in place. So we've got number 1, number 2, number 3, number 4, number 5, number 6. So the first arch is number 1, which is the mandibular arch. Number 2 is the second arch, which is the arch for the hyoid. Number 3 is the thyroid. Number 4 is doesn't really have a name, it's just the 4th and the 6th. Okay, like so. And remember, they are paired pharyngeal arches like so. Outside here would be the skin, so that's the outside of the embryo, and on the inside is the endoderm. So I'll start with the first pharyngeal arch and how we develop the tongue. So all this kind of area in here, like so, comes from the first arch. So all that red area is the first arch. And now the anatomical structures at this point. Now in the inside of the pharyngeal arch is all endoderm. So endoderm, in terms of the pharyngeal arches, produces the mucous membranes and any glands. And so you can see these 2 swellings on either side of the internal. Sitting up here would be the mouth, which is coming in like so. So this would be the mouth of the embryo like so. So the 2 swellings on each side of the first arch is what we call the lateral lingual swellings. And then we have 1 medial swelling there like so. And that's called the tuberculum impar. And so they're all the structures of the first pharyngeal arch. Moving to the next type of swelling, this is the swelling a bit further down. That's called the copula, and that is kind of the major middle swelling as we move down slightly. And so this particular eminence, called the copula, has structures from the 3 arches that follow. So the second arch kind of comes through like so. The third arch goes through like there. And the 4th arch kind of comes through like there. And so you can see that that particular structure there is made up of 3 arches. Now here we've got the laryngeal inlet. So that area there is where you're going to get the branching down into the pharyngeal, or the lung bud going down in front. Now if you were to look down on this image, if I was to colour in blue all the endoderm, which is the inner lining, here we've got the head, there's the eye, so this is the mouth here, which is going to be here and sitting above there like that. So this tube as we go in, this is all going to be endoderm derivative. So all of that is endoderm, like so. Now when you go down kind of at this point here, we now split, and that's this point here. So you've got a front pipe at the front and a back pipe behind it. And so this is going to be the lung bud that's branching off, so that's the laryngeal inlet, and this is going to be the gut tube going down to the esophagus. So these are the two pipes that branch off, and so this is going to be the pharynx, larynx, where you have the separation, which is going to be in this region here. So kind of where we're sitting here at 6, that's going to be this esophagus pipe sitting right like so. And so that's kind of the main structures that you need to be aware of at this point. The final point before I move on is this demarcation point of the red. So where this is sulcus terminalis. And you've got a midpoint of the sulcus terminalis, which is there. And that's called the foramen cecum. Okay, so that's important to be aware of. All right, so let's go forward a few weeks, and now we develop a much more adult-like structure, so that should make a lot more sense to you than that one. And so we've still got the first pharyngeal arch here, which is still going to make all this area here like so. So all of this is the body of the tongue. And so all this front area is from the first arch, like so. And so that, if you were to measure it, that area to there would be the front 2/3 of the tongue. And so that should start making sense to you, because you should know from the lecture on the pharyngeal arch, the first arch is supplied by the mandibular branch of the trigeminal nerve. And you should know that the anterior 2/3 of the tongue is supplied by the lingual nerve, which is a branch of the mandibular branch of the trigeminal. So the third branch, V3, essentially supplies the body. Now, that's the sulcus terminalis, that's the foramen cecum sitting right there like that, which is there. So now what do we have is, here's the second arch, kind of in here. But in terms of, just for completion, just so we are really accurate, sitting kind of here as well is going to be the tonsils. So the tonsils will sit in there, which is kind of a second arch derivative. So I probably should have drew that in blue, if anything. So that is really the only derivative left of the second arch. All that back part of the tongue doesn't develop anything further. So there's no real structures from the second arch in the tongue. So what we're left with now is all this area here, which is the third arch. And that comes to the back of the tongue. So that should tell you the posterior 1/3 of the tongue, comes from the third arch. The third arch is the glossopharyngeal nerve. So the back of the tongue is glossopharyngeal. Now I think we'll pause there for 1 second. So you should have a question of, well, is there anything that comes from the second arch? And that's a good point, because the second arch, as we know, is facial, and actually the remnants of the second arch actually migrates into the front 2/3, but that's purely for special sensory. And so the anterior 2/3 of the tongue, special sensory, is second arch, which is going to be the facial nerve, so the chordae tympani. The rest of the anterior 2/3, like pain, like temperature, like touch, is lingual nerve, which is V3, which is mandibular or lingual nerve, yeah. So, take-home message is the anterior 2/3 of the tongue technically has two innervations. That it's general sensory, which is going to be pain, temperature. Mechanical is lingual branch of the mandibular trigeminal, but the special sensory, which is taste, anterior 2/3, is facial. So when you're testing the tongue, be aware that there's two nerves, kind of one for taste, one for sensation. Whereas if you go to the back, that's completely glossopharyngeal, and that's taste as well as general sensation. So all the back 1/3 is completely glossopharyngeal. Now going to what's left, the top area here, the vallecula, and the top part of this developing cartilage is the epiglottis. So the epiglottis kind of sits here. Epiglottis cartilage sits here, which comes off the fourth arch. So that's going to be vagus, or more accurate, the superior laryngeal branch, as well as the vallecular, or the back part of the tongue. So that's going to be the fourth, and then all the rest is going to be the back of the sixth. So that's going to be the striated esophagus. Okay, and that's going to be the sixth, which is recurrent laryngeal. So that's really the main areas of the tongue. And so if you can remember that, it will make a lot more sense. And that this black area here is going down to the lung bud. And so the final point just to be aware of is that's all sensory of how the tongue is created. The only other aspect that you need to know is the motor to the tongue. And now the motor actually comes from the occipital somites. So the somites which are making your muscles, there's some that come from your occipital region and come around and into the tongue. And they drag the nerve with it. The nerve, which is the bottom part of the medulla into the first part of the spinal cord, cervical spinal cord, that's the occipital somite innervation, and that's going to be the hypoglossal nerve. And so that's cranial nerve number 12, and that gets pulled with it. And so movement for the tongue, so to move the tongue, that's going to be completely hypoglossal nerve, whereas the sensory is going to be lingual and glossopharyngeal with a bit of chordae tympanae for taste from the facial nerve. So that is how the tongue develops. Hopefully that makes sense. Now we move down to the thyroid. Now the thyroid isn't too complicated either. What you can see here is that's the gut tube, so that's the endoderm. In here is we've got the tongue in red, like so. So that if you look at this image, this is in a sagittal cut. There's the top lip. So this is the philtrum. Here's the top lip, bottom lip going down to the chin. Here's the front incisor teeth, the top incisor teeth, the hard palate, and this is the top of the tongue. So this is going to be the tongue here, like so. So it's a big muscle. And then we go down to the hyoid and the thyroid, like so. Now, the way that the thyroid develops is it actually has an invagination at the back of the tongue. So it will come through the foramen cecum. And so from the foramen cecum, we have this thyroglossal duct that will kind of come down and communicate through the tongue, like so. And that's going to invaginate like this. And so this is going to be thyroglossal duct, like so, but it's got this thyroid that starts to. So that's going to be epithelial cells that have migrated from the endoderm into that area, and now it's going on its way down. And so the thyroid wants to go down in front. So what it's going to do is it's going to migrate kind of in front of, and then kind of loops up behind the hyoid bone, and then continues down in front of the thyroid cartilage, where then it sits out here like so, and then having two main lobes with an isthmus in the middle, and that will sit on either side like that. So it's going to migrate down and around through the thyroglossal duct. So the main thing just to be aware of, it kind of originates from the foramen cecum, comes down in front of the hyoid, loops up behind it a little bit, and then migrates further until it arrives down in front of the thyroid cartilage at about the 7th week. Okay, and as we saw with the pharyngeal arches, we've got in the pouches here, we've got the ultimobranchial, which is going to create the C cells, the calcitonin cells, the parafollicular cells, and we've got the superior parathyroid coming from the fourth, and the inferior coming from there, and they're going to get pulled down. The third one, or the inferior parathyroids, they get pulled down with the thymus. So the inferior parathyroids are going to sit at the bottom, whereas the superior is going to sit up there, and they come from the fourth pouch, okay? As well as the C cells will go and infuse in there, as well as the follicular cells, which are coming and are going to invade it, as well as the C cells. So that's kind of how, and then by about the third month, it's completely invaded with these cells and probably starts to become functional to produce. The C cells, as you know, start to produce calcitonin to cause calcium to come down, whereas the follicular cells helps to release T3, T4, and the parathyroid glands helps to bring the calcium levels back up. So hopefully that will help. That's the development of the tongue, which you can see has really come out of a few arches, and you now can see the innervations, as well as how the thyroid gland descends out of the back of the tongue and down to where it lies